mynews.studio.
Imagine a world where cases of preventable blindness fall by 94%. What does that change in real terms? And where does the fight against trachoma go from here?
Today is January 27th, 2026. Just a couple of months ago, the World Health Organization shared that, for the first time, fewer than 100 million people now need interventions for trachoma. That's down from 1.5 billion at risk back in 2002. How did we make that kind of progress?
A lot of it comes down to the SAFE strategy: surgery, antibiotics, facial cleanliness, and environmental improvement. But the real progress happened because each country adapted these interventions to their own context. Take Ethiopia. 64% of global cases are there. They put a huge focus on scaling up surgeries and mass antibiotic treatments. In 2024 alone, more than 70% of the world's surgeries and antibiotics for trachoma happened there.
So that's about 46.7 million antibiotic doses worldwide, with a big share to Ethiopia. Why did Ethiopia become the main focus? Was it just because of the numbers, or were there other reasons?
It was both. The numbers were high, but there were also big obstacles: remote villages, limited infrastructure, and cultural factors around hygiene. Other places took different approaches. Burundi, for example, targeted antibiotics in just 12 districts. In the Americas, the emphasis shifted to hygiene promotion, especially with remote and indigenous communities.
So, there wasn't a one-size-fits-all solution. I have to ask about digital tools. Did technology play a role in targeting these efforts?
It did. Smartphone-based surveys and digital data tools were crucial. For instance, teams used digital surveys from tropical data to pinpoint trachoma hotspots, even in places that are hard to reach. They also tracked by gender, which helped focus on women and children, the groups most affected.
Since you brought up women and children, what about community engagement? Did local leaders or gender-specific efforts help overcome some of those barriers?
Absolutely. Community health workers, many of them women, became the backbone of these programs. In Ethiopia, they went door to door in remote areas, distributing antibiotics and teaching about facial cleanliness. Health ministries, together with NGOs, trained local leaders to organize hygiene campaigns. Messaging and interventions prioritized women and children, since they face higher risks.
Were there points where people resisted these efforts? I'm thinking about cultural norms. Sometimes those can be major hurdles for public health work.
Yes, resistance did come up. In some areas, taboos about eye care or skepticism about medicine made things difficult. That's where trusted local leaders played a big role. When women saw women from their own communities leading, it made a difference in acceptance.
Now, with fewer than 100 million people still needing treatment, what are the main challenges left? I assume funding is high on the list.
Funding is a big one. The estimate is between $268 and $334 million needed to finish the job by 2030. That's where partnerships come in. The International Coalition for Trachoma Control, for example, brings together health ministries, NGOs, donors, and researchers to make sure resources go where they're most needed.
Are there new approaches to financing or data collection to help reach those last groups?
There are. Digital tools like tropical data and the Global Trachoma Mapping Project help target resources more precisely. Regional partnerships like the PAHO Canada model also focus on collaboration and reminding donors about that 94% reduction in risk since 2002 is key to keeping support strong.
It seems like this isn't just an eye health story. Preventing blindness also boosts productivity and eases the strain on healthcare, especially in places with fewer resources.
Exactly. It's a win for global public health that extends well beyond eyesight. It also shows that neglected tropical diseases can be tackled when the effort is coordinated and sustained. This approach could be a model for fighting other preventable diseases.
So the lesson here: tailor interventions, invest in community leadership, and use innovation in both technology and funding. That's how you move the needle on big health challenges.
And the story isn't over. The next challenge is taking these lessons to other diseases, or even other sectors? That's the big question for public health as we look ahead to 2030.
Today, we explored how a global health crisis can be tackled through strategy, technology, and local leadership. From mass antibiotic campaigns in Ethiopia to targeted hygiene initiatives in the Americas, the adaptability of the SAFE strategy made a difference.
And as we aim for final elimination, it's those partnerships, engaged communities, and precise targeting that could put trachoma in the history books.
Thanks for listening. This episode was brought to you by mynews.studio. You can try it for free.